What's up, y'all? It's Ashley.
I'm Fee.
It's Melody.
And Cody here. And you've tapped into
The Mama's Den.
We're all mamas, and we've got 11 kids between the four of us. And let's just say we are tired. But we're also friends who are going through this journey of motherhood together.
Each week, we are giving you some laughs, maybe some tears, sharing our personal stories, and of course, giving advice, what we hope is helpful.
This is the show we wish we had before becoming mamas.
So grandmas, aunties, sisters, uncles, daddies, brothers, everybody who's in the village of raising children, we got you.
Shall we get into it, ladies?
Let's do it.
All right. And welcome to the Mama's Den.
Matthew McConaughey.
How y'all doing?
All right.
Good. In the world.
Because she said, all right. I was like, what are you, Matthew McConaughey?
Is that, oh yeah. All right. Doesn't Kevin Hart do it too?
He does.
Oh.
Red.
There you go.
Oh my
I
goodness.
did not know that.
No, a lot of people don't know that because I used to attribute it to Kevin Hart and they were like, no, it's Matthew McConaughey.
That is Matthew McConaughey.
It is
He
Matthew
started
McConaughey.
it.
It's both. I love this for us.
It's
All right, how was y'all's weekend? Look, I'll tell you how mine was.
How was it?
I thought I would have a day and a half to myself, and I didn't because my family who went to Big Bear came home mad early on Sunday
my
morning.
goodness.
God, they
So-
missed you.
Tommy said, we're going back to the house.
Tommy said, I miss my woman. I'm coming home,
Girl.
girl.
Say, come get these kids.
Basically.
He said, I done had enough.
I literally had like a leisurely coffee,
Oh, dang.
little breakfast at home. I went for a walk, and they were
cute.
home when I got back.
That's cute, though.
No.
I'm glad you got to start your
Wait,
day,
so wait,
though.
they didn't even say, hey, we're home. So you
I
just
mean, I texted.
sneak
I
attack?
did hit him up, and I
Should've
was
gone
like,
for a
"When are
little
you
extra block round,
gonna
walk around the
return?"
block.
I know.
There's nothing
Call
worse
Ashley, be like, girl, come pick me up.
than going on a walk and coming home and your family's there. That's got to be the worst. Wait, I wasn't ready yet.
Yeah, for real
I
though.
wasn't ready.
For real.
How was your weekend, Fee?
It was good.
Was this a baby weekend or was this a no kid weekend?
This was a kid weekend, but I slept a lot, to be honest.
good.
I slept. My mom was here. We went on a walk, went to the park. Just doing a lot of like normal things.
I love
You
that
know,
for
just
you.
taking it easy. I'm tired of it moving so fast.
Yes.
Yeah.
I definitely, Jared was out of town, so I definitely took the liberty to have Elmo be in the house with us this weekend on the television as much as I
Hey.
wanted on Sunday. I cooked all the meals from scratch.
Oh,
I didn't order anything. I didn't spend any money ordering food. I'm very proud of myself. I cooked all 3 meals at home, which means I also spent 7 hours in the kitchen, which was trash.
Ooh.
But, you know, I saved money. And I stayed in my pajamas all day on Sunday. I'm not even going to lie. I stayed in my pajamas.
lovely.
all
That's
I
day.
love
It was a
that.
good day.
Me too.
That's
Aw,
amazing.
Okay. What about you, Ashley? Everybody had a peaceful-ish weekend.
Ashley
I
was
did
forced
too.
to clean.
Yeah, I was like, she
well,
was cleaning.
I did too in the beginning when I woke up extra early with the baby and we were watching Paw Patrol because she's literally been obsessed and now she watches all 3 movies every single weekend.
Oh.
And then Father Chia woke us all up out of our slumber and relaxation and made us clean the house, like scrubbing baseboards, scrubbing the
Ooh,
windows.
he hit you with the immigrant parent
Yes,
weekend.
yeah, this is what my mom used
This
to
is
do.
what my mom used to
Yes,
do.
every Sunday my mom would turn on Bob Marley and we would have to scrub the house. When we knew
Yeah.
we heard Bob in the background,
Oh
it was
my
time to get
word.
to scrubbing. Yes,
You're like,
and so I turned on Bob Marley and we
Nice.
cleaned. I mean, it was like 4:00 when we were done cleaning.
I've
my
never heard you
gosh.
call him
Yeah.
Father Chia until he made you clean.
Oh,
Yeah.
I always call him Father Tree when he makes me do chores with the children as if I'm one of his children.
Got it.
Like it's like a subtle. We're all cleaning now, and it's like, oh, I guess
I like
we
him
are.
telling you what to do.
Do you?
Yeah.
I do too.
Well, look, y'all, we also have a guest joining us today, okay? And I believe that the Zoom is ready. So we have Administrator Chiquita Brooks-LaSure. By the way, Brooks is my maiden name as well. So very excited. So she's joining us virtually from DC. If you are watching the Mama's Den on YouTube, you can see her. She is the head of the Centers for Medicare and Medicaid Services and will be sharing some information, very valuable resources for soon-to-be mamas and mamas that are listening out there. So she's going to help us make sense of what our administration, what our government is doing to help us, which is a lot, actually. So we're really excited to have you joining us, Administrator LaSure.
It is my pleasure to be here.
You're a mom. And
I am a mother.
Yeah. So tell us a little bit about your motherhood journey before we dig into it.
Oh, well, as I think I can speak for so many mothers, being a mother is just brings so much joy to one's life. And for me, my daughter is now 10 years old. It's a running joke of whether she will be taller than me by the end of the summer or by the end of the year. I'm trying to hold out for the end of the year. She's just one of the greatest joys in my life.
Yeah.
And I think I personally just feel like motherhood has helped me be a better leader and be a better person.
Yeah. Yeah.
Mm,
We might agree with that.
yes.
Ashley has a 15-year-old. Is Amira taller than you, Ashley?
No. So I actually have 4 children, to be clear, 4 daughters, not just a 15-year-old. But I do have a 15-year-old, and she's not. I reached my full height in 9th grade, and I think that the women in my family are very tall, but none of us are taller than our mothers. So I think we're keeping with tradition. I'm not taller than my mom. My mom's not taller than her mom. So I think we're good to go. She's like right here. I'm still taller.
Well, cool. Should we jump in, guys?
Yeah, let's do it.
Okay. So, administrator. In June of 2022, the Biden-Harris administration launched the White House blueprint for addressing the maternal health crisis. And y'all, I'm definitely reading today because I want to get all of this
Yeah.
Yes.
perfectly
I
correct.
Please do.
And so that is with Vice President Harris leading the effort to bring the whole of government to bear on this crisis that we are all at this point in the Mama's Den fully aware of. And through a sustained multi-year, multi-agency effort to combat maternal mortality and morbidity and reduce racial disparities nationwide. And so, we've talked about this a little bit here in the Mama Sin. I know, Ashley, you've shared your experience with your first daughter
Mhm.
in Ohio, because now you've been in California for the last 3.
Yeah.
Will you share a little bit about your experience with Medicaid?
Yes. So first, can you clarify? I was on CareSource. Are CareSource and Medicaid the same thing?
It may be.
Okay.
There are so many names for Medicaid, and it depends on your state.
Okay.
So I imagine it was, but
Okay. So I had CareSource when I first got pregnant. I was in college, and then I left college to go live in New York and follow my dancing career. So I was working at a restaurant in a school during the day, but I didn't have any benefits. So when I found out that I was pregnant, I moved back to Columbus, Ohio, my hometown. That's where my now husband was living. And I wasn't on his insurance. We weren't married at that time. This is 15 years ago. I couldn't be on his employee insurance without being married. And so I had the government insurance, which was CareSource. And I didn't, I had positive and not so positive experiences. Obviously, like they paid for my braces full out. So that was great. And I didn't have to pay for anything, like not one thing, not one prenatal appointment. I didn't have a doctor's bill after I had my baby. So obviously at 24 years old, moving back home and having to restart my life, that was really great that I didn't have to bear the financial burden of having a baby. I would just say obviously this is 15 years ago and things have changed. At that time, the experience with finding a doctor was really hard because actually a lot of the doctors didn't accept the insurance. And then it just kind of left me to go to the city hospital. I had a different doctor every single time. And it was kind of like a clinic that you would go to for that insurance, and a maternity clinic essentially. So you didn't really have that personal experience. And I would say that was one of the downfalls of having that insurance, that it was kind of everyone kind of got it. You feel like you were herded in and you weren't really treated with that extra care. And a lot of times when I had my other children, could tell the difference when I obviously was on my husband's insurance. Then those experiences were vastly different, the way I was treated when people were like, what kind of insurance do you have? So I don't know. I'm just hoping you can kind of speak to that. And obviously 15 years later, I'm sure things have changed and how that works for young moms or people in general that have public insurance, or Medicaid rather.
absolutely happy to talk about this. And this is a real area of focus for me personally and for the entire administration. I would say even broader than maternal health, which I'll turn back to in just a minute. We as an administration have put out so many new requirements around the Medicaid program. And so much has changed since 15 years ago for Medicaid. I think there is a new understanding in our country about how important it is to have everybody have coverage. I would say a couple of things have changed. One, the work of President Obama of passing the Affordable Care Act. There's a new understanding of how important Medicaid is for everyone. It's important for people who are between jobs. It's important for the middle class. Medicaid pays for more of mental health services than any other program in the country. And so I think that we have more of an appreciation that there are over 80 million people today who are on Medicaid. And I think that we are working to strengthen the program. We actually just put out new rules to states saying you have to make sure that you are paying your doctors adequately so that you don't have long wait times, you do have participation, and it's really to address the concern you just said of people not being able to see the doctor that they want to see. And so that's been one of our core efforts to really make sure that when people are on Medicaid, they're getting the same coverage that they would if they're in employer-sponsored insurance, if they're getting through their employer, if they're on Medicare, and also now, thanks to the ACA, if they're on what we call Affordable Care Act coverage. But to go back to maternal health, which just to say, I cannot tell you how important this is to all of us. And early in the administration, the vice president convened the maternal health cabinet, and we all went around the room, the secretaries of every agency, to say what they were going to do to make sure that we together address the maternal health crisis. And it was really moving to see talking to the Secretary of Agriculture, talking to Veterans Affairs, talking to DOD, talking to all of us to say, what are you going to do to make sure that maternal health is improved in this country? Because we all know that we have so much further to go. Black and brown mothers in particular have disproportionate health outcomes. And one of the things that I always want to say whenever we talk about the disparities is it is regardless of income. So we see those differences regardless of education, regardless of insurance coverage. And I have done so many discussions with women and advocates across the country. And I'm so struck with how many women who look like me talk about their experiences with their doctors and their concerns about maternal health, regardless of their education and income.
Administrator, we have like a lot of nitty gritty questions just to make sure
Yeah.
we're being super clear with our audience. But I'm
Absolutely.
curious before we even get into that, what are like three things you would say, like three changes you would say you're most proud of that you've seen? You know, you mentioned everyone who stated what their department would be able to do to improve maternal health outcomes. But like, what would be just the top level things that, you would want to share as things you're most proud of right now?
The things that I'm most proud of first are getting more people enrolled in coverage and getting states to cover women 12 months after you give birth. So we are at 46 states that have expanded postpartum coverage. And those of us in health know that you need to make sure you are seeing the doctor before you get pregnant. You need to see the doctor when you're pregnant, and you need to see your doctor after you're pregnant. So many of the deaths and comorbidities that come are after you give birth. And all of you know this, but just my own experience, I gave birth 2 months after, I'm in the doctor's office trying to juggle who's going to take care of the munchkin because my husband was overseas. Just you're thinking about so many things when you are postpartum, and to have to change your insurance company and find a new doctor and find new coverage, it's so crucial that women and their baby get that health insurance and are able to see the doctor. So I am so proud that we have been able to get so many states to expand postpartum coverage 12 months. That's the first thing, and we're going to keep going. We've just expanded so much coverage. The second thing that I'm incredibly proud of, and you can see the icon behind me, is our birthing friendly designation. So, one of the things that we did was put an icon on our website. You can go to medicare.gov, and you as a expectant parent can look at your hospital system, and see whether they have an icon. I'm so proud of this for a couple of reasons. One, because I have learned so much in this job that when we CMS give out a gold star, people want that gold star. They want to know that we have said something positive about them.
Mm-hmm.
And this is helping people to know that this hospital is engaged in best practices to address maternal health outcomes. And I love it because it's using the Medicare program. Medicare program doesn't pay for a lot of births in this country, but hospitals and doctors pay attention when Medicare pays for things. Medicare actually desegregated hospitals in this country. It is a powerful tool. And so I love that we are using the force of our agency to encourage providers to change. And the private sector has picked this up. So not only are we using this icon, but health plans are also using it, which I think is so important. We have a role, of course, but the private sector needs to adopt those. So those are the two of the things that I'm incredibly excited about. But I'm also just thrilled that we continue to try to get at just the start of our question of making sure the coverage that you get is effective. And so we are working on so many pilots, we call those pilots, but so many projects to make sure that best practices get embedded into the work, and that we're incorporating the lived experience of moms, of stakeholders, of people telling us what things they want to see, and we're working hard to get that embedded into all of the work that we're doing.
Thank you.
You know, I'm sure there's lots of things that come up, myths and misunderstandings about what Medicaid is. And we have a statistic here that says Medicaid covers about 41% of all births in the United States, yet over 60% of those are to Black women. In your experience, what would be the factors that contribute to this statistic, and why? Why is that the case? Why are these numbers that way?
Well, Medicaid is increasingly an important player in maternal health outcomes. We're seeing that a lot of women who are having babies are at different ends of the income scale, right? We see that sometimes it's lower income women who are having children, and so that may be part of the reason why Medicaid is providing that coverage. That's what Medicaid is for. Medicaid is to make sure that anybody who doesn't have insurance can get enrolled and get coverage. And most of the states have expanded Medicaid to cover most people who are lower income. And again, many middle class families also depend on the Medicaid program. But we know that there are income disparities in our community, and that is likely a factor in why Medicaid is such an important part to the important in terms of coverage for our community.
Does that income level range change from state to state, or is it a national number, that threshold?
It does change from state to state. There are some states that go higher, but in general, about 133% of the poverty line, which for, say, a family of four, that would be about 44,000. These are really rough numbers. But in general, if you're lower income, you are below those levels, you should be eligible for Medicaid. Above that, now we have Affordable Care Act coverage, which has is subsidized by the federal government. So it's private insurance that you get through healthcare.gov or through other state-based coverage.
Mhm.
But I would say if you are a person listening and you do not have coverage, you should go to healthcare.gov, because healthcare.gov will get you routed wherever you need to go for coverage.
Love that.
Now, we've been seeing a shift, I think, recently in the education and the
Mhm.
options available to women as far as their birthing journeys and what resources are available based off of choice, whether they want to be in hospital, have doulas, midwives. And you also mentioned postpartum care. What are some of the things that you could share with us that are covered by Medicaid in the journey from prenatal, during pregnancy, and postpartum? Are some of these services covered? Because out of pocket, they can be very expensive. But I know we're kind of inching, and we have friends of the Mama's Den who are currently working to create these options for women to choose how they would like to birth and what their birthing experience would like to be. But some people don't have access to the resources, and that's what we're working towards. So, can you share what is covered with Medicaid if those services are?
Sure. And some of these services are really decided at the state level.
Mm,
What we at the national level have been trying to do is to really encourage states and make sure that we have a holistic perspective as we deliver, as care is delivered.
mhm.
And so there is, I think, new awareness and appreciation for the role that midwives and doulas are playing and should be playing. Many of our states have initiatives where they cover doula services, where they cover, where you're able to deliver in the setting that you would like. That is the one that you should check in with your state to ensure that you have a real understanding of what's covered. But I will say we spend a lot of time making sure that some of these best practices are being uh, incorporated into the way that people are being able to make their choices.
And where would an expectant mother, parent find that information? How would they know if their state does provide those things?
The best place to check is probably with your provider, and
Okay.
it doesn't need to be your OB, but your primary care who can help you navigate. You can certainly, if you're on Medicaid, check in with your state, and you can get healthcare.gov is a great place to start where you get routed to your state. But of course, if you Google your state Medicaid office, that's another way where you could find the information. But it does vary sometimes by when you're in Medicaid, you might be in a different managed care plan. So private coverage is like, I think the name of the plan you were talking about might actually have been a health plan. So you can check with your health plan about what they cover.
Okay.
And I think I read something. I mean, I know Melanie touched on this, but I feel like you all have made a concerted effort to make sure that there's either doula or midwife care, like more so available than in years past.
We definitely have been emphasizing just the importance of these collaborations and really encouraging states. So we have a couple of the language we would use are models. We have places where providers can enter into these collaboratives where we will pay for those services.
Mhm. Oh, great. Um, and something else you said earlier about extending care 12 months after birth, but
Mhm.
also making a point to improve the quality of care.
Yes.
How do you define that?
What I define improving the quality care are a couple things, making sure that people, and certainly we're talking about maternal health, can get access to the doctors and the providers that they need. So, some of our areas of particular focus are primary care, maternal health, and mental health. So, we just put out new rules where states are going to have to prove to us that they are paying adequately to make sure that if you are on these services, are getting access to the care you need. So, what are your wait times? So, states are going to start reporting to us. How long does it take when I call up and say, I need to see my OBGYN? How long is that time? And we just put new requirements to make sure that people could go get their doctors. And part of how you make sure that's the case is by making sure you pay adequately and And when you pay doctors properly, they will treat the people who are coming to their office, treat them well.
Yeah, I agree with that too. I think Kim was talking about that, is how they're not being paid properly. So it just makes the whole system like makes it very difficult. So question, I feel like within our community, there's a lot of speculation. There's a lot of people are afraid to go to doctors. A lot of people are afraid to take medication. What are some things that you could just, I guess, like encouraging words that you can tell our community on just trusting the system, and that not every doctor is bad, not every, hospital is bad, that you can lean on it and this is somewhere for you to be supported?
I think this is one of the most important things that we are collectively working on, of making sure that when people go to see a provider, when they go see their doctors, their nurses, that they feel like they can trust that person. And so I would say a couple of things. One, we are using our power to say it is important, doctors, nurses, all of you, to care about health equity. When we, as the government, as I was saying, Medicare desegregated hospitals, when we say something is important, then people respond. And this administration and our office is really focused on saying, we want to make sure you are treating everyone well, like you are being what we call culturally competent. You are meeting people where they are. And I think some of this is also not on us, but everybody listening to me should feel empowered to say to their provider, if they're not getting the care they need, that they deserve it, that they are entitled to it and can go somewhere else if they're not getting it. Because some of what happens in our community, as well as others, is we don't feel confident in our voices, and it's normal and natural. Like when you are going to a doctor, you're in a vulnerable place because something is wrong, and you want to figure out what's going on. So I think I want to make sure people know they have a right to advocate for themselves. And if they feel like they need help, sometimes bringing a person along. I mean, one of the things I think that doulas are so effective about is you have an advocate there. But even if it's for an office visit, there's nothing wrong with bringing along someone who can sometimes be that advocate for you. But I want to say we are doing everything we can to make sure that Medicaid, all of the programs that we administer, that there is an understanding that we are looking and watching and wanting to make sure that people are getting the care that they need. It's one of the things that I'm most passionate about for our agency. We cover almost 1 in 2 people in this country. Over 160 million people are covered by the programs that we run. And so it is my mission to make sure that everybody who is treated under our programs gets the care that they're entitled to.
I don't know if I'm being too much of a dreamer with this one, but do you feel like there could ever be a possibility of maybe some type of postpartum bill being passed to where moms don't have to go back to work? So, and not saying they have to go back to work, but going back to work and maybe they're having financial support. We know that you said up to 12 months, they have the Medicaid option. But then what if there's also like a financial aspect as well, like some type of financial relief? Do you feel like that's something that could possibly happen one day?
I think that it is, the vice president says some version, I'm going to paraphrase, of every generation, like you have to keep fighting for justice. And I think, yes, that it is good for you to be a dreamer and make sure this happens. So I gave birth in this country, but I went abroad for my husband's job for the first almost 2 years that my daughter, when she was really little. And so I got to see how other countries treat women postpartum.
Right.
So as soon as I got there, I got enrolled in a program that teaches you how to be a mom, right? Because none of us are experts the first time we give birth. We're expert in other things. We're not expert in child. The first thing I learned was how to do CPR on a baby.
Right.
Right. And then I was in a class with this will go back to your question of paying for, I haven't lost the thread, but I was with a group of women, and we were taught by a nurse once a week, and we could ask whatever questions we wanted. And there was a support there for the first 3 months. And the women who were in my group, almost all of them had a year that took the entire year, because they had a year of paid maternity leave. And then every company had to give you an option to stay out another year. So the women there just had more time to get to know the process. And I mean, we had the range, right? Some babies went to sleep immediately. I don't know about your child, but that was a long process for us. And I can't honestly, and my experiences were different, in part because I was out of the United States of get right back to work and figure out how to pump if you want to pump while, in the law now says that your employer has to give you space to pump, which, thank you, President Obama, Affordable Care Act. But I didn't have to juggle so many of those challenges. And I think that had a lot to do with my own personal journey, which is why I came back and learned so much about what was going on maternal health. But now I had the experience of imagining what it would be like to try to get back to work and having to navigate all the things that come, going to work tired. And I believe it is important that we continue to advocate for women to be able to make their own choices about when they're going back. And one of the reasons I remember, this was very early in my life, sometime in my 20s, I was at an embassy of one of the smaller European countries. And they said, we can't have women dropping out of the workforce. That's why we have 1 year of maternity leave. They understood the economic reason why it was important to have maternity care and to offer these options. So that's what I would say in terms of your optimism. I think that it is important to continue to advocate for the things that we think are right. And I think it is not only the right thing to do for our moms, for our families, but also we need to think about what it means to our economy. If the people giving birth in this country are so stressed and strained that, they don't have the health outcomes that we would want.
As the resident Canadian, I support this motion to happen for the United States of America.
I love Canada.
Yes.
What Canada are you from?
I'm from Toronto. I would love all women to have the option to have 12 months with their child, for sure. Because I see that it's possible, and I see how beneficial it is, for my friends and who've had their children in Canada. It is. Administrator LaSure, thank you so much for all of your information and for your presence and just, helping to us further to dive into this very important topic. Can you please let our listeners and our viewers know where they can find more information if they're looking for it, and where they can find you as well?
Absolutely. Go to cms.gov, cms.gov, and you can get routed to so many different web pages of all of the work that we're doing on maternal health. And I just want to thank you again for lifting up this topic, for really giving me an opportunity to say how much we care about maternal health outcomes and want to do our part to make sure that we improve them in this country.
Thank you.
Thank you so much.
Can I ask a quick question? What is the difference between cms.gov and healthcare.gov? So when we share, we're being really clear.
Absolutely. So cms.gov is a place that talks about all of the things that we do, which is a lot. Healthcare.gov is really focused on getting people enrolled in insurance. So healthcare.gov is the best place to go if you need health coverage. It's really set up to get you enrolled in coverage, where cms.gov is really about all of the work we're doing. So initiatives, what we're doing on the birthing friendly designation, that is somewhere and there's so many of our websites, but cms.gov is a great place to start.
Cody, we have our question.
So we have our question of the
Yeah.
week. We have our listeners and viewers write us. We'd
Mhm.
love for you to participate.
Okay.
Those who might have a question in the future, please send us an email at podcasts@blacklove.com or hit us on Instagram in the DMs at the Mama's Den podcast. But today's question, Ashley, read today's question.
Okay, I will read it. It says, I consider myself a scrunchy mom. Do you know what a scrunchy mom is?
I don't.
It's just kind of like modern day hippie. And I'm trying to have the least amount of screen time for my 9-month-old. I've decided I can't even watch TV when he's in the room because he's become more aware of it. He gets about 30 minutes a day from Mrs. Rachel, but what else can I do with him to occupy his time? I try to do jazz and nursery rhymes while playing with him and do other stuff to get through the day. But also, how do you guys feel about screen time? So do you want to answer that first?
I was thinking, I was going back to 9 months. I don't know about you all, but that first year is a blur. So.
Exactly.
Yep.
I tried to focus on really limited screen time of things that I thought were educational. So that helped. Kids at that age really like repetition. So if you find something, I found just these cute little clips from Sesame Street. So not the whole episode, but just 5 minutes. Or there are so many resources out there in terms of educational things that you can videos. But I lean towards personally feeling okay with allowing my daughter to watch what I to watch some screens, but not unfettered. Let me be on the internet and just allow YouTube to take it away.
Yeah. I think for me, I try to stay away from screen time within the first year. Just their eye development, and the doctor was just like, medically suggesting like it's not good for babies to look at screens that young as their eyes are developing. And then as they get older, I think same for me. It's just like limited. And then, they get older, they can have a little bit more and a little bit more. But I feel like within the first year, it should be like a lot of one-on-one, like you talking to your baby, doing little flashcards if you want, playing little games, but less and less screen time, I
I think
think.
sis is also tired. I think that's
I
where this
know.
message came from. But I agree with
I
you.
get it.
I would also like to say, though, and I'm somebody who definitely with my first, who's 8 now, was very much like, limited screen time. Don't let the screen time happen. And now we have to control his, like, we don't allow him to watch screens or play video games Monday to Friday because we see how deeply it affects his ability to focus and what he wants to do, like getting what he needs to get done. So just so you know, friend who's listening, when they get to a certain age, even older than 9 months, you're going to have to regulate some stuff as well.
True.
We're also living in technology time, period. Like screens are everywhere. We're talking to you on a screen right now, And so I think that like we also have to recognize the evolution of what's happening. Like our baby, we FaceTime our grandparents with our babies. We're always on our phones. Our children see that. So they are naturally evolving to this very comfortable level of like, it's like a second language to them.
Yeah.
My daughter's 2. We never gave her the phone when she was a baby. This girl knows how to call. She knows how to take pictures of herself. She knows how to do voice notes. We've never given her a phone.
She posted to Instagram.
Yeah, she posted to Instagram. How, like a very like cute picture of her and my dad. Like what? It was very interesting. So I'm seeing this shift that's happening already where these kids, it's a part of their language. It's a part of their evolution as well. And I know that we're in this time right now where there's a lot of information conflicting on what is good and what is not good. And I just think you got to do the best that you can and know that like, it's just, there's an evolution happening.
Yeah.
We're in it. And in a few years, 10 years, 15, 20 years, there's probably going to be a whole other study that says these children need technology because it will keep them behind if they're not able to act like a computer because we live in computer times, So I don't know. My advice to our listener would just be do the best you can. I have a child now who's 2 who is on a plane, does not cooperate. And so I will say that a screen has been very helpful when traveling. And so you can use it as you need to assist a healthy experience for yourself.
My 2 cents at that age, though, just agreeing with everything that you all are saying, it was really important to me to watch things with them. and like interact with the things,
Right.
ask them questions about the things. I don't remember if I think I read that somewhere, but like it allowed us to process what we were watching together. If some shows have call and response, and so is my kid actually responding or
Right.
acknowledging that a question has been asked? It's
That's
like
good.
whatever. What is that show? I want to say Mighty Express or one of them truck shows where they ask you a question like, "Do you jump or do you ride?" And it's like ride, whatever.
Yeah.
And so I think for me, it has been really important to watch as much as I can with them and
Smart.
just kind of make sure that they're not just staring at it blankly and they're actually engaging with it.
That's
good.
That's good
That's
advice.
Why, thank you. Anything, Felicia?
You guys said it all. I've been a little bit of all of it.
Well, Administrator Brooks-LaSure, thank you so much for joining us and giving our audience and listeners like all of these great resources. We will be sharing cms.gov and healthcare.gov with the people. Anything else you want to add before we let you go?
Just thank you again so much for having me and for creating a safe space for Black moms to come and talk. And it was a pleasure to be with you.
Thank
Thanks
you.
for
Thank you
being
so
here
much.
today.
Thank you so
Thank you for all
much.
that you do.
Yes, thank you.
Thank you.